This video we're going to show you how to use the home cervical unit. We recommend these things for a lot of our neck patients. This one we're going to show is called the ComfortTrac. It's very similar to the Saunders unit, which is a more popular one. The ComfortTrac, first of all, you want to make sure that the setting is high enough. On here, you have to squeeze, and it can go to a couple of different levels. Okay, so the further away means it's going to be a lot lower. And this is where the therapist you're working with should help you in that endeavor. If you don't have a therapist, you're just doing this at home. You basically want this thing to be about 30 degrees up, okay, depending on your body frame. So this is the middle section is usually the one that we use the most. So it's about there. You can see it's about a 30-degree angle from the bed or floor, whichever you're doing. The other thing that's adjustable is the cushions that are on either side of the neck. These cushions move in and out. There's clips on each side, on the underside. So you want to, you'll squeeze the clips open or close depending on your neck size. Basically, when you bring them in, you want the pads just to touch on either side. They don't need to squeeze hard, they're just a light pressure. Here we have the patient laying on the machine. So I'm going to reach under, and you can do this yourself just by reaching up. And once you get familiar where the clips are, it's simple, easy. You can just squeeze and then push it in. Do you feel them touching either side of your neck?
Yeah.
There we go. You can see the angle we have. If you look at her head, the angle is approximately around 30 degrees as she's lying there. This particular unit, a lot of the units have these straps which are supposed to secure your head. I don't find that's really necessary, and a lot of people don't like being tied in. They feel trapped, so I choose to not use those. So we have her in position. We have the pads pressing on the sides of her neck, and we have her at a good angle. The units always come with a little controller. This looks like, basically it's a bicycle pump. If you just pump it like this, what's going to happen is you're going to start seeing the black pads here are going to move up the track. That's why they call it a ComfortTrac. You just keep pushing it up, and what I'm going to include, I want her to pump this until she starts feeling a very slight pull in the neck. We're not looking to stretch your neck. We're not looking to make you taller. This is just to decompress your cervical disc. Tell me when you feel a little pull in the neck.
I feel a little pull.
A little pull. You can see I just pumped it a few times. There's a gauge on a lot of these. You can ignore the gauge because it's all about what you feel. So you're going to pump it up until you feel a slight pull and just leave it right there. I recommend that you have it on the traction for about 30 to 60 seconds. After 30 to 60 seconds, you just release the pressure. On this particular unit, there's a little button right there. You just release, and it goes back down to its original position. And as soon as it reaches the original position, you can pump it right back up. So we're going to pump. Tell me when you feel a slight pull.
Slight pull.
Good. 30 to 60 seconds. And we release. Why we do it release, pump, is very important, because the disc, when you take the pressure off a disc, the blood is sucked into the disc. And when you bring the pressure back, when you release the traction, the pressure comes back onto the disc and it pushes the blood out. That action, that's why we have it doing it intermittently. You're tractioning it, release, traction, release. So you're creating a pumping action into the disc, creating better blood flow, which helps with the healing process. So I'm going to hand this to you, and you're going to pump it up as you see fit. So pump it up until you start feeling a little pull. And she leaves it there for 30 to 60. There should be no pain experienced with any of this. She should not have any pain in the neck, no pain going down the arms, no numbness, tingles, any sensation like that. Those will all be negative, and you don't want to, and they're probably not appropriate for the device if they experience those kind of symptoms. Okay, when using the home cervical traction, we recommend you use it frequently. You can use it as often as you like. Okay? There's really no downside, especially if it doesn't cause any symptoms. You can get on as little as 5 minutes or as long as 20 minutes. And make sure you're doing the intermittent pump release during the whole time. You can use it as many times a day as you like. And if you have a hard time setting this up, because it can be a little complicated, I recommend that you contact your physical therapist. If you don't have one, you can probably find one in the area. If you're one of our patients, feel free to give us a call. Come in, no charge, to show you how to use it effectively at home.